So awake breast augmentation is only done by a few surgeons who are actually truly board certified. I've been doing awake breast augmentation for over 15 years now, and I have done thousands of cases and never had any issues. The benefits of awake breast augmentation is that you basically avoid any risks with anesthesia that's considered with general anesthesia or sedation. So that could be nausea and vomiting. Some people, 20% have nausea and vomiting no matter how many medications we give them, and that can last 20, 24, 48 hours or so. You avoid all that with the awake. When you're awake, there's no respiratory issues. So many times when we do anesthesia, you might have a tube down your throat, you might wake up with a sore throat afterwards. Some people panic and hyperventilate. So because you're awake through the whole thing and I'm talking you through the procedure, you avoid all those issues. Basically, there's no physical or mental impairment. Many times patients sometimes wake up combative after anesthesia because suddenly they're awake and they don't remember where they are or what happened to them. So they wake up combative. Sometimes there have been incidents where patients actually hurt themselves, where they started banging things or hurting some providers by punching them and stuff like that. So when you're awake, once again, you avoid all that. You're clear-headed through the whole thing. Some people have hallucinations when they wake up a little bit. And so once again, you're clear-headed when you wake up through that. There's no issues of hypothermia. Many times operating rooms are cold because we want to prevent infections. So although we do take measures to do that and measurements, still sometimes it's not seen that the patient gets colder and colder. If you're awake, you would just tell us that you're cold. And we would implement steps to warm you up throughout the procedure. Also, there's no need for DVT prophylaxis because you're laying and all your muscles are perfectly relaxed under anesthesia. Your blood's not flowing properly, and because of that, your blood can tend to clot. You avoid that issue completely with being awake. Also, you avoid any narcotic issues. Narcotics has side effects. Many people complain they make them feel funny, feel lightheaded, dizzy afterwards. You avoid all that. Sometimes some of these narcotics can cause urinary retention, where basically the patient then is done a procedure in the surgery center, and because they can't urinate, they actually have to go to the hospital, get it catheterized or put a bladder in, and then they have to see a urologist and have it taken out for 24 hours. There's no need for any of that when you're awake. Also, there are less tests needed because we don't need tests for anesthesia to be done. And also the benefit is you don't have to fast. Many patients can't eat or drink after midnight. The anesthesiologists don't want to have anything in the stomach because if you get nauseous and vomit, potentially you could put food in your airway, which could cause a problem breathing, or it could put some food or bacteria in your lungs, which can cause a pneumonia. So you avoid all those issues awake. You could have a light breakfast, you don't have to fast. And a lot of my anesthesiologists have always told me the best anesthesia is minimal or no anesthesia, which you avoid with awake. The awake is done completely under local anesthesia. I also offer to give some medications ahead of time to relieve any anxiety issues, but that's just like having a few vodkas before you go into the room. It's not going to put you out or put you under or anything like that. So there is another problem that's associated with anesthesia. It's called malignant hyperthermia. It is a very, very rare conditions where actually some patients having breast augmentation died. It's kind of like an allergic reaction to anesthesia where the body overheats itself. And so doing this under local anesthesia, you completely avoid that. That's usually a highly genetic thing. It's a very rare event. Most anesthesiologists I've talked to have never even seen it, although they all know about it and learn to treat it. When I do anesthesia, I offer anesthesia here as well. So I have all the safety requirements in case that happens. But that's one less thing you would have to worry about with the local or awake procedure. Also, with the local Awake procedure, the beautiful thing about that is I talk to you through the whole procedure. So because I talk to you, we go over the post-operative instructions and everything. So usually the outcomes are better, I find, Awake, because patients remember the recovery instructions better. Because not only have I told them before the surgery, but once or twice, but then I also told them during the surgery. And I can also tell them again after. Many times after the surgery, when you give people instructions, they're under medications from anesthesia. They're not going to remember much. And also, if you tell them everything right before the surgery, well, they're about to have surgery. They're really nervous. So many of them don't remember much either. But if you tell them before the surgery and then you tell them during the surgery, they seem to remember a lot better and they follow their post-op instructions better. So the outcomes are usually better. Okay? Also, there's less need in the recovery room. We don't have to wait for you to wake up because you're awake. Usually we just take one set of vitals, with breast augmentation, usually we just take one set of vitals and we get you dressed and you're out the door, right there. All those things are advantages of Awake or local breast augmentation.